Would you please give a warm welcome to Shirley Douglas, actor, activist. Thank you very much.
Thank you. As Dan Benedict said, it's too much. Thank you, thank you. Please sit down. I tell you, if my father were here today, he would be a very happy and proud man to know that I had been invited to speak by the President of the Canadian Auto Workers at their convention. And also that present was Dennis McDermott and Bob White and all of you. It's a tremendous honor and one that I appreciate enormously. I want to talk to you a bit about where we came from. Because if we don't understand where we came from, it's very hard to know where we're going. I was born in 1934, the first year my father was defeated. And he was elected in 35, and we went to Ottawa, where we stayed until 1942. Because so many young people are here today, and it's very encouraging that you are, I want to tell you what it was like. Campaigning in Saskatchewan and throughout the country for the CCF was about as tough as it gets. It was cruel in many ways. The things that were being advocated in those days were beyond the comprehension of many people. It was also the time of the Klan being very big in Saskatchewan and south in Montana and throughout a large part of the western part of our country. And I remember too many trips campaigning when swastikas were painted on the car, when tires were slashed. I remember my father standing on a platform with a water jug, and when they started to come up towards the platform, he broke it off and was ready. And I remember that not once or twice, I remember it often. And I'm saying that so that you get in context, the same thing has happened and was happening before that even, in your own movement. My favorite, no matter what, will always be Mother Jones. Mother Jones, Joe Hill, all your own people in this country. The people that sat down in Windsor. Those people suffered and fought like nobody now can imagine. I think there's nothing I admire more than courage. But I'll tell you, my God, I have never seen the courage of those people. Miners that took on the mines, with the guards standing there. You never saw a mine being taken that you didn't hear 6 had been killed. Our people were killed and ground into the ground in this country. So when we inherit a union like you have, or we inherit a party, never forget the foundation that was laid for it. We owe them a great deal. My father came back to Saskatchewan to run in the election in 1944. And it was a very tough election. But the great thing that it was called was humanity first. And that was something that we had and we understood and that we must never, never lose. It was a great landslide. And the first thing that was to be brought onto the books as soon as possible would be hospitalization. And hospitalization was Each person paid $5 and a maximum of $30 per family. That entitled you to go into the hospital, everything that happened to you in the hospital until you came back out of the hospital, with the exception of the doctor. It was tremendously successful. It went on for some years. We were still unable to finance the doctor's end of it. And in 1961, in October, in the legislature of Saskatchewan, the act was passed that would allow Medicare to come to Saskatchewan. The full first hospital plan in North America. We had the doctors' strike in 1962 on the 1st of July. I want to tell you what it was like, that doctor's strike. The American Medical Association, the Canadian Medical Association, the propagandists who had stopped Truman, who had a very good medical bill at one time, proposed, the people that stopped the Kennedy medical bill, the insurance companies, they descended on Regina like an army of people who had come to defeat any prospect of this health system going further. They put up a fight the likes of which I have never seen before or since. They whipped the community into a rage with false propaganda. If you were to buy into this health plan, they would decide what doctor you had. Anything the doctor was told by you would be sent to the government. Stories after stories after story, and the community became very upset. The GPs were mostly with us throughout that. It was the specialists that were finding this not a very attractive proposition. And so the doctors' strike did start July 1st. And it took 24 days. It took an airlift of bringing doctors in from England. It took an appeal. My father went to the radios and appealed for people to come to Saskatchewan so that we could continue looking after patients. And that was the end of it. And from that moment, it then became the example that the rest of the country could take and make our national health care system. It was very interesting. It was actually John Diefenbaker, whose mother was very, very ill in Saskatchewan, and he saw how it worked. And he appointed Emmett Hall, Judge Emmett Hall, that we must always remember. It was a royal commission, and you know what can happen with a royal commission. And he came out and he said, why would we look any further? We have what most of the world is looking for here in Saskatchewan. And gradually it was accepted, and we have now the Canada Health Act. When the Canada Health Act came into being, people were so excited and so thrilled with this that every party wanted to take claim for it. But what they never did, because when you moved the health system from Saskatchewan to Ottawa, you did not have the philosophical underpinnings to keep an eye on it and to change it as medicine changed. And for 20 years it was let grow, and it was let insurance companies to come in and privatization to slowly sneak its way in. And there was no one there in the government to protect it. And when we look now